Hello.
Hello, Madam Mary.
Yeah, Koiti, has the meeting started or not yet?
It's about to start. We're waiting for you people to join.
I already joined.
All right, we hello everyone. We are waiting for the Prime Minister of the Zande Kingdom who hasn't joined us yet. Muted. Oh, my apologies, I was muted. Good afternoon, everybody. I am Koiti Emily, the co-founder and executive director for South Sudanese Women in Medicine, a nonprofit that brings together female medical doctors, pharmacists, and dentists of South Sudan. And simply put, we are women who believe that when women lead in healthcare, communities thrive. And We now bring you the third part of our webinar series that I am gladly going to moderate, or I have the honor to moderate, having been permitted by my team to do so. And I said that we are now 16 minutes late. We're still waiting for the fourth panelist to join, who is His Excellency Tadeo Mario Sasa, the Prime Minister of the Azande Kingdom, but he's still unable to join us, and we'll proceed in the interest of time. Hopefully when he joins us, he'll catch up and we'll ask his questions along the way. On to this webinar, titled Reframing Immunization Beyond Mothers to a Shared Responsibility. As you've all have seen on our poster, it is the third one in a 4-part series that we have organized as part of our critical advocacy and communication project. And we are thrilled that all of you have joined us for a discussion that is essential to the health and well-being of our communities in South Sudan. And this comes after the successful national launch of the pneumococcal conjugate vaccine, or what is commonly called PCV, and the rotavirus vaccine, which took place on May 27th of this year. And we find ourselves at a pivotal moment, and the rollout of these vaccines to us represents not just a health initiative, but a collective commitment to securing a healthier future for our children. However, for us to achieve sustainable vaccine uptake, it requires a broader approach, as many of you know, one that transcends traditional roles and engages multiple stakeholders in the immunization journey. And that has really informed why we came up with this webinar series alongside other activities that we've conducted under our project. And so today's webinar, as I have already said, titled Reframing Immunization Beyond Mothers to a Shared Responsibility, invites us today to broaden our perspective, because immunization is not solely the responsibility of mothers as it tends to appear. It requires a holistic, community-driven approach where all members, fathers, healthcare professionals, community leaders, and organizations alike play an active role. And so by sharing knowledge and fostering cross-sectoral dialogue, we can build a more resilient health system that champions vaccine uptake. So throughout today's session, we will explore ways to strengthen health system advocacy and share best practices, and hopefully harness the collective strength of our communities through what we are going to hear from our panelists. And so our esteemed panel of speakers will guide us through discussions aimed at building capacity among all of us, and those who are absent who will catch this series through our YouTube and Facebook channels. And we hope that it will help all of us become effective vaccine champions, because that is also what we are aiming at. It should not be only SSWIM or UNICEF, the distinguished partners we've worked with doing this work. It should be every South Sudanese caring about children getting vaccinated. So along the way, I encourage all of you as your moderator, the moderator of this session, to engage actively. Please ask questions and share insights as we go along, because we are working together to ensure that equity, sustainability, and accountability in vaccine introduction and routine immunization in South Sudan is a reality. So thank you all for being part of this critical conversation. And so we are going to embark on it together, and I'll start by naming who our esteemed speakers for today's webinar are, and then just reading out what the agenda is going to look like. I'll just talk about who they are briefly, and then we will dive straight into the Q&A for them. And then after that, we will invite all of you who will have questions or comments to make them, also bearing in mind the time we will have been left with, having lost some time already. And then after that, they will make their parting shots while answering questions too, and then we will make an announcement and then have a virtual photo. So welcome everyone, and thank you for coming. So who are our speakers today? As you have all heard, We do have somebody who you already heard, and that is Madam Mary Obat, who spoke earlier. And she is the Director for Health Education and Promotion at the National Ministry of Health. So it's right to assert that she leads that docket in the entire country, and then the others at the state level do collaborate in that sense. So we welcome you, Madam Mary, and thank you for honoring our invitation to be part of today's webinar. And then we also have Mrs. Tabitha Nyanthich Garang. Our poster could not accommodate all the names, but that is her name, her full name. She's a mother, she's a housewife, and a teacher trainee currently pursuing a Bachelor of Education at the University of Eastern Africa, Baraton in Kenya. However, she's mostly based in South Sudan, where she bore her children and also had them all vaccinated here in the country. Then we also have a clinical officer who has worked extensively in our community, has experience in working on social behavior change, who is Mr. Kudum David. He's a dedicated South Sudanese health professional and passionate about community health, and specializes in serving vulnerable populations. He did some work during the COVID-19 pandemic days in 2020 to 2022 at the National Emergency Response, helping to coordinate and deliver essential services, and eventually went to PG County, that some of you have heard of, where he led efforts in social behavior change communication, promoting health facility deliveries, and increasing the uptake of routine vaccines for children under 2 years of age. And so his work, as he is here, exemplifies his commitment to improving health outcomes in challenging environments. Welcome, Mr. Kudum. He's a clinical officer who holds a diploma in clinical medicine and is currently also pursuing a degree in public health. That is it. I don't know if our other panelist has joined, not yet, but whenever he joins, the much about him is that he is the Prime Minister of the Royal Azande Kingdom. That is His Excellency Prince Tadeo Mario Sasa. If he joins us, we will be glad to have him and have his questions. And so, having said that, I would like now to go straight to the questions, and I will start with you, Madam Mary, our Director for Health Education and Promotion, if you're there, I will ask. Yes, thank you very much. I'm glad that we can hear you.
Yeah.
And so there is this thing that every time we talk about immunization, what flashes in a person's mind is that it's about a woman holding a child and having them vaccinated at a vaccination clinic. And the question is, why is immunization still perceived as a women's burden, and how can policy messaging disrupt this trend? If we can start off with that, that would be a wonderful thing for us to then go on to the others. So you're welcome. Please unmute.
Yeah. Thank you very much. I hope you can hear me.
Yes, you're very audible, Mary.
Yeah, I'm unmuted myself. Yeah, thank you, Koiti, for moderating this very, very important webinar, meeting or panelist meeting. This is very important because, you know, some of the issues that you have outlined here are very, very important issues that, you know, we need to all discuss together as gender, because gender is including men. So before I go to your question, I just want to highlight a little bit about historically, you know, what are the gender roles, and especially in our context of South Sudan. Gender roles, you know, it has been there from time immemorial, and it is actually, the roles are dictated, okay? Dictated by the society that we are in, and, you know, and that men are usually seen as leaders, men are seen as providers, as the head of the family. So the role of a man is that, while the women are expected to be nurturing and supportive, okay? And because of that, this has led to stereotyping, that can limit, for instance, the personal and professional growth of, some of these women. And if you see now, the society has changed. During my mother's time, things were different. Women accept, that role. And education was also very limited. But now with education, you can see that the work that men are doing, women can also do. So going back to your question, why immunization is still perceived as women's burden, and the policy that we need also to employ so that it can disrupt the trend. Now, since society has made it that, the role of children is the role of a woman, and especially babies, okay? Men think that babies belong to the woman, and they think that they cannot even hold the child. It's the woman who will always remember when the child is hungry, when the child wants to defecate, when the child is this and that. But actually, this is not, this is something we need to discourage. And to discourage this kind of trend, it needs, us to take gender seriously. And together, men and women, we need to discuss these issues thoroughly. Because I don't condemn all men. There's some men who really understand that their role is also there in the family and in the children. So we need to have some kind of policy messaging. It's not that we need to force them to, for instance, men to take responsibility of the children in the house. No, but there are ways that we can, start from family level, household level, and then we go to the community level, and then institutional level. So those levels, if we start doing it correctly, then we can change, the narrative of, responsibility being, especially for children, being for women alone. So this is what I can say for now. But as we progress in our uh, webinar, I think I can also come later on. Thank you, and this is what I can say for now.
Yes, thank you very much, Madam Mary, for responding to that. You've actually even responded to what is supposed to be the second question. But at this juncture, I would like to welcome our fourth speaker, who is His Excellency Prince Tadeo Sasa, Mario Sasa, who has been able to join us, and all of you can see him, his camera is on. Welcome, Your Excellency. We appreciate you sparing time to join us this afternoon. And people already know that you were to join us. And with that, I am going to put you on the spot. And Madam Mary has talked about the fact that we do have gendered stereotypes in our community. How childbearing and child rearing is a thing that is seen to be for women. And you are the Prime Minister of the Azande Kingdom, and that's a big community that you administer, which has its cultural norms, it has values, it has a way women are expected to behave. There are also things that men are supposed to do, gendered roles, to be precise. And so we would like to understand what are the prevailing perceptions regarding men's roles in childcare and health in the Azande community, especially concerning immunization. now that we have more new vaccines coming with time, we had the PCV rolled out and Rota. We had malaria vaccine introduced last year to 28 counties, and now we have it going out to the rest of the 52 counties. What are those perceptions? What is it in the community that you see prevails that is the perception about what men and women can do, specifically what men can do in the community concerning immunization? You can unmute and speak to us. Welcome.
Yeah, thank you very much. My name is Prince Sasa Tadeo from the Zambia Kingdom, the capacity of the Prime Minister. I'm very honored to be invited for this important Zoom meeting regarding the immunization of whatever, which is organized by South Sudan Women in Medicine. So from the beginning, I would like to pass to you the greetings of His Majesty King Atoroba, our Majesty King of the Zande, and also the whole community of the Zande, especially women and children of the Zande Kingdom to you. We are also would like to applaud the woman, South Sudan woman in medicine, for taking bold decision to conduct this program, which we consider is very crucial at this special moment in South Sudan. I'm coming here as somebody from the culture background. So all my contribution will be based on the culture and norms of people of South Sudan in general, because we as traditional leaders, we share maybe 90% or 95% value, and also we are living in the same similar environment. Regarding the question of immunization, I think traditionally it is there, the issue of immune system in the body is there in our culture. So it is there in our culture in understanding that you cannot attain full health at a given point. It is a process that begins when the woman is pregnant. So we have to reserve certain food for woman to eat, level of work to be handled until the time of birth. Also, the woman or the child will be treated according to some tradition that will keep that baby very strong, and also the baby will be extremely grow under restriction of the family, what to do, what not to do, what to eat. You can see also the food is divided: food for children, food for young people, food for old people. So all these are measures that taken to ensure that when somebody reach old, he goes through mechanism of health that will keep him healthy throughout his life. So this is the principle of culture aspect of immunization. So coming now where we have intervention of vaccine, the introduction of vaccine for us in the culture prospect, we are considering this as a result of development, the development that happening, that now the world is not longer closed, it is open. So you can see now there is intermarriage, there is also flow of culture, there is importation of culture, being it food, being it the weather itself is changing from time to time. Even the food system, how people are getting food now, there is artificial product that are coming and mixing. People are taking as a food. You can know all this more than me. So it causes problem in in a human system of the body, which is contrary to the culture that people used to have. So now this is where now people start to develop some disease, some viruses that's coming, and there is no cure for it. So of course, all of us now are subject under the development of scientists and medicine looking for how to cure or eradicate such a phenomenon in the community. So we have example like malaria. This is an old situation that is known here in South Sudan. And I think this is, we as a traditional leaders, we support this kind of initiative of vaccine. So the vaccine for malaria has helped us along through decades. Even for myself, since I was a child, I've been seeing this vaccine is very useful for children. And also now, the recent one now you are introducing is also very helpful because we left with no option because those things are very complicated how to find it and how not. So we don't have choice as a traditionally culture people. We have to welcome it because we need to keep our people alive so that we really have a healthy community free of disease, free of health problems. So this is the first attention. There is another observation also, which is very sometimes very negative, because we also at culture aspect we are reading what is taking place in biology and also the new drugs discovery and all this. So we are also very reserved for whether we have a capable health institution here to investigate those imported vaccines. So to ensure that those vaccine is okay for us here. Some vaccine can be okay for people living in Europe, but for us also the environment change here. Or is it qualified that we all of us subject to it, or we need to assurance from you, from our national institution here to assure us that yes, it is okay. So this is just observation we are putting and also recommend to South Sudan women to give us answer about this. This is also some of the questions that we are facing from our people. So I can be able also now here to champion on your behalf and give correct answer. Regarding the role of the family in the Azande Kingdom, I think you have seen our king. He's a role model of how to encourage people go for vaccine. Very recently, on the 9th, this month, we launched the vaccine for hepatitis B and C in the kingdom, in which His Majesty the King and the Queen and all the ministers in the kingdom spearhead. The king himself was vaccinated. So this is a very big example for our community. We are supporting this health issue very seriously. At level also at the home, we can see how the head of family are very serious to ensure that if the mother goes to hospital and she has been prescribed medicine for children, it is a man or the father is to ensure that that medicine, the woman has given the child the medicine and whatever they are also, sometimes they goes together to the hospital and come home. This is just an example.
Thank you very much, Your Excellency, for that really detailed response to the question. You touched on also some cultural practices that exist that can be leveraged. Already, the king and the queen are participating actively as champions of vaccination. You've talked about hepatitis B and C already having been launched in the kingdom. Congratulations upon that launch. We do appreciate your efforts to continue to protect the communities in the United Kingdom. That's commendable. And you've also talked about the role of fathers, how they are the ones who encourage the mothers, but also have reminders. They nudge the mothers to take the children to vaccination. And it's good to have somebody to remind one. And then you've also said that sometimes they go to the health facility with the children, with the mothers to have them vaccinated. And that is very good precedent that can be leveraged to really undo the negative stereotypes that we see or perceptions around what vaccination means. Vaccination children really involves among the parents. And so thank you very much. And then to clarify or to respond to your question, the vaccines, before they become introduced, there is what is called the South Sudan Technical Immunization Technical Advisory Group, CTAG. That is comprises of healthcare experts, people in the national ministries of health. It also has some partners sitting on it, and they are the ones who really sit and decide that this vaccine is safe and should be approved for South Sudanese children or adults to have. So that is what happens. The vaccines that you see in the country have been thoroughly vetted, they have been approved, there is good oversight, and so they are cleared and safe for our children and even the adults to. I hope that answers the question. There is good leadership at our National Ministry of Health ensuring that our communities are safe. And these vaccines are also recommended by the World Health Organization, and also they come with the support of the Gavi Vaccine Alliance. And but with time, there was a conversation last week where we are saying it's important that we consider that we have to take up the responsibility of financing our vaccines and ensuring that we pay for them ourselves as a government. We can't continue to perpetually rely on donor efforts to get vaccines in the country. Now, I would like to shift and move. Kudum, I'll come to you. Stay patient. I see that you have asked to be given a minute. I'll give you a minute. I'm trying to sequence the questions, but I want to go to Tabitha. Tabitha, I hope you're there and that you can hear us clearly. And having heard what the roles of men are in one community in Western Equatoria and the Grande Kingdom, and which, according to the Prime Minister, is that we have shared values across the country. 90%, 95% in his words is we share a lot in common. And you are a mother, you are a housewife, you've taken your children to be vaccinated, and you are actively involved in the nurturing of your children. So the question is, before we go to how we can change policy at family level, at institutional level, at community level, as Madam Mary has said, what are the biggest challenges you have faced when you had to take your children for vaccination? And how do you think men or male involvement would have really, really reduced some of these challenges that you faced? So welcome, Tabitha. You can unmute yourself. I hope you're there.
Yes, yes. All right. I'm sure you are getting me right.
Yes, Tabitha, we can hear you. Please go ahead.
All right. Thank you for the chance, the opportunity to be among the people, especially my prince and the rest of the members. Thank you, Dr. Emily, for leading the program. Actually, as a mother, being a young mother, I'm not only speaking on my behalf. Okay, some of the challenges I might have not faced them myself, but the other women outside there are also facing them. So one of the challenges, to be straight to the point, sometimes as a mother, the title mother comes with a lot of responsibilities. Like for my case, I'm a housewife and also I'm a student at the same time. So balancing these responsibilities, and I believe I'm not the only mother, there are some others outside there. Balancing these responsibilities, being a mother and other responsibilities, is not that easy. For instance, some mothers live far away from these health facilities. So traveling long distances and leaving the other responsibilities in the house. For example, a mother who has other grown up, okay, let's say kids who are 5 years, 4 years, 6 years, and then there is this small one you are supposed to take for vaccination, and then the health center is not that near, it is far, you have to go some hours. You know, in the villages, people go for some hours trekking. Now you see how to balance this, leaving the other kids in the house, going to the hospital with this one. Who is to take care of these ones you've left in the house? And then the time you will come back. When you see balancing these household responsibilities and traveling those long distances, it is a great challenge to me and to us as mothers. Not only that, but we have also, there are these negative stereotypes or myths about vaccination. You know, some people believe, and where I come from, I've been hearing some stories. So and so took his or her child for vaccination. Then, after the child was vaccinated, the child became sick. In the process, so and so lost the child because of these vaccines and all this. So, we have different myths, we have these stereotypes. People believe vaccines are not safe and all this. So, as a mother, it is very hard, it is actually challenging to now sit down and make a decision based on what people are saying, mostly with first-time mothers. Sit down now and decide what to do. This is what people are saying, and this is what you are supposed to do. So how do you overcome this challenge? We are really facing it as mothers, and we are really requesting if actually we can be helped, because it is becoming challenging. Even me myself, I experienced that. To add on, we have this issue of economic burdens. Like I said earlier, you know, some mothers traveling to this, like for instance, let's talk of those mothers who are in the cattle camps, those ones in the villages. It requires them to plan. You go for a journey, you travel to where there are these health facilities in order to vaccinate your child. And you know, traveling those distances requires finance, transport. How will you sustain yourself in town and all this? So that one is a burden for us as mothers.
Yes, thank you very much, Tabitha, for that. You have talked about the fact that the negative perceptions about vaccines make it difficult for mothers to decide what is safe for their children, the misinformation that is out there. You've also talked about transport issues, taking care of yourself, especially when there is a distance. The distance is long from from home to the health facility where one is going to get vaccinated. Of course, we know that with conflict that the spatial distribution of healthcare facilities across the country is such that health facilities could tend to be far away from people, and so they could have to walk distances. But we are also glad that there are community health workers. There is also mobile clinics that happen in some places to ensure that people are reached in hard-to-reach areas and they are vaccinated. That is happening in some flooded places. It's happening in some parts of the country. But of course, in urban settings, that is something that we can continue having a conversation about, because there are also unique challenges, like what you have said, the assumption that each mother will always afford transportation and really cease to worry about whether they will have food as they go for the long distance. If they have to go all the way from Shirikat and there is no primary health care center, there is no government health facility there, and come all the way to, say, Juba town, where Al Sabah Children's Hospital is, or to Kator, that could be quite a distance for a mother. And so thank you for really bringing that to us. I see that some people have had power interruptions and we have lost His Excellency the Prince. We hope he'll be able to join us. We also had a bit of a power interruption, but glad to be back here. And now I want to go to Kudum. You have worked in the communities and you have tried to see that behavior in the community changes. What have you observed is common behavior or practices that really make it difficult for men to participate in immunization programs or taking our children to be immunized, before we can go to thinking about what are the most effective ways that you observed? We would want to first know what have been the things you have observed in the field. You can talk about them and then also go ahead to elucidate on when you observed that, what then worked, what was the most effective way to initiate a conversation with those men or the community so that the behavior then changes to ensure that they participate in their children's immunization. You can unmute and you're welcome.
Clinical officer, it is a really great question to ask me such kind. In actual sense, in places which are very remote, immunization uptakes for children and in the community is really a great challenge. Mostly fathers, or let me specify as men, we don't take enough role in uptake of immunization. Mostly they think of it as a role of a mother, a role of a female, a role of anybody who's a family member to make sure the child is taken for immunization. And actually that is the one thing key that I've observed in the community, especially in the low extreme part of the country, even in part of the towns like Juba and other part of the cities. Men mostly thinks like once his role is not to look after a child, is only to go and look for where to get a job, bring food on the table. But actually, it is not a really good sign. It is not a really good thing. As a father, your work is to be a protector, and protection starts from immunization. If you take your child for immunization, you are protecting that child. You are keeping the child to be safe, have a safe, healthy living. Therefore, in this kind of scenario, it is really difficult for people to understand in the roles as a father to be a protector of the community or in his family. In such kinds of cases, most of the time are things like, if I go and do my business that I will bring the food on the food table, then that is the only rules. That is not a real thing. So as a father involvement in immunizations enhance child strength and safety. We know all mothers have a lot of busy schedules in their domestic work, and sometimes a mother forget what he's supposed to do and what is supposed to take a child. So it is a really a role of father to remind the mother that please, mama, somebody need to take for immunization. If not, you take that child for yourself. Take the cat with you. Take to the facility. Let the child be immunized when you're even present there, and see how the child immunization is taking place. When you father go with the child, you also ask a health workers what is the importance of this immunization. They will give you more details of the importance of those vaccines, and you really have the knowledge on that. So in most of the beliefs that people are having nowadays, they say that child immunizations is only for fully responsibility for mother, but that one does not come. All in all, it is really bad. I would take you to one of the example. I've been in those remote areas in the country. I decided to create a group of men discussions on immunization, where I involve one of the FIAM leader, who is a male, to be a group chairman of the leader of that group. So every Friday, he sit down with members, and in his meeting, he will share the importance of immunization in his meeting, and also he also make sure that after the meeting is done, uh, he make announcement in the community to let all the mothers and all the fathers in the community to take their children for immunization. So in this type kind of scenario, it helps thousands of children to be immunized on that day or on that period of time that I was in that remote area. And people take it as something positive because a leader himself, as a male, involve himself in such kind of activity. They know now this immunization has no harm in children. If a leader who's a male talking part of it on this one, then they will know currently this is something safe for their children. So as a man or as a father, if you talk of something, involve yourself in something in it, therefore it will encourage the mothers and to encourage the female. You will protect the family in such a way. Protecting a family is not a physical protection, but through decision, a critical thinking and decision making to protect a family like what immunization is. So when children are immunized, you are protecting your child from other uh, unpretty diseases, and these diseases are preventable through immunization. These are really specific things that I've really encountered in my field site, and what I've come to know. It is a really negative thoughts to the family members. But if we involve the parents in immunization, especially father, you will see the uptake of immunization is 100%. Thank you. That is all my point.
Thank you very much, Kudum. That is really educative to us of what you've experienced and what has worked. Those male educational groups led by the PAYAM leader are really eye-opening. Welcome back, Your Excellency Tadeo. We imagine you must have experienced some challenges that made you disconnect, but we've not gone too far. And we have just had Kudum share with us what he has observed in the communities, the perceptions that are there, and how those can be overcome through safe spaces for dialogue, like what he created to ensure that there are groups where men have a leader and they occasionally meet to discuss, and how that undoes a lot of negative perceptions around immunization and reinforces the right messaging that encourages immunization. And so with that, I think Kudum, you've gone so much. I had you've responded to some issues that I would have asked as follow-up, and thank you for really anticipating some of the questions I would have asked. I want to go back now to Your Excellency Tadeo. Good that you have come back in time. And Mr. Kudum has shared about what works. What has worked is where he has relied on a community leader, and in his case, is a PAYAM leader to be the leader of a men's group where immunization was discussed, and that promoted immunization uptake and good. Good people being receptive about immunization. So, and that is a community leader. So how can, in your perspective, how can community leaders effectively champion the message that immunization is a shared family responsibility, not solely a woman's issue? I know earlier on you talked to us how the king and his beloved queen have all ensured that they are vaccinated. Leading by example is one way. And but beyond that, beyond the fact that you also say that men can take children for vaccination in the Zande community, men do remind women to take children for vaccination. What else can community leaders do to effectively champion the message that immunization has to be a shared family responsibility, not a thing for mothers only? How can community leaders do that? You can unmute and you're welcome back.
Yeah, thank you very much. I'm sorry the line was off, and I'm now back again. This particular question is very relevant, and we also, to our capacity and authority, this is what we are facing as a leaders, and we have also a strategy in order to improve in this issue of our responsibility to comply with any emergency that are there for our community health. The simple thing we are doing is I already testify how His Majesty the King, as head of our community, is very serious about this issue of vaccination. Second to it is the structure of the Azande Kingdom is top down, starting with the king, then coming to the paramount chief, to the headman, come up to the Zanderman or woman family down there. So when there is, we have something called campaign awareness. So always, be it a government, be it an organization, when they have something to be introduced, like a vaccine, like a new medicine that need to be applied, the first thing they do is they're targeting the head of community, like the kingdom, the chiefs. So we have to have a serious meeting with them to understand what kind of vaccine is, and how the treatment takes, and what's the side effect, the full information about the medicine. Then now we assign the chiefs or sub-chiefs to mobilize people to come for this vaccination. And at that time, we can see also those vaccinations are not taken at the premises of a hospital or clinic. It is taken to the community center where people are there because people trust the community. When the vaccination is performed within the community center, so people trust it because now it is in the possession of our community. This is number one. Number two, also, it become now an obligation. When the traditional leaders are involved in the process, it become now an obligation, because nobody as a subject in the community will try to deny or register absence for during this vaccination, because there is other consequences for that. So this is also another support, another privilege that do we have as a traditional leaders, that the issue of comply. So people do comply 100%. Sometimes living in the rural area is not like city, where you can see people staying at one particular area like that. But in the remote area, people are scattered. Some are at farm, far away, and far away. So we as a traditional leaders also, when we see that this treatment cannot reach up to the grassroots, we have another means of it. We communicate this through traditional instrument. Like for us, we have a Google. There is kind of message we can send in Google in the morning, early morning, or early in the evening. So when we beat this Google, it is sending message that there is something need attention of people. Every head of family will try to come and know what is this, and then now the information get involved. Also, when there is negative prospect about certain vaccine, we introduce the artist. We have local traditional artists. We will sing a song. This song will talk about this vaccine, what it does, and how it cure, and you must come. So when it become now like a song, everybody will welcome. They will dance with it every day. When they are eating, they are going farming. Also, this dance remind them to come for the vaccination. So those are the means that we have enable us to mobilize our people to come for vaccination. Lastly, is the responsibility. We have sense high responsibility as an Azande people regarding the health issue. When there is any phenomenon that can delay or diminish our community, we are very serious to get cured or to get health wise. Thank you very much.
Yes, thank you very much, Your Excellency. You have really told us how what can happen, and I'll try to summarize with leading by example. Already the king and the queen are doing that. All of you are doing that. Very commendable. Being part of awareness campaigns, and how all of us who are working on these awareness campaigns as organizations should be targeting you first to be informed, so that then you inform the community. That is well noted. And then you can also be the ones relied on to ensure compliance, that nobody misses out, that we target those who fail to get vaccinated for one reason or another, so that they get, for example, the catch-up vaccine, the PCV catch-up vaccine that is being given to children who are already above 1 year and up to 5 years old, because those ones are, if they missed it, when the vaccine was not yet in the country, they can now get it. And also in sometime in April, we also had those who had missed the measles vaccine also get a catch-up, our follow-up vaccine. So that is very important, and it's good to know that it's important to rely on you, and those are some of the critical roles you play. And then also you mentioned the use of traditional music and dance to compose music and folk and dance that emphasizes the messaging about immunization. That I'm sure there are colleagues here who work in the on vaccine advocacy who are also taking note of it, and those who take note of that. And now I want still I would now want to go on to back to really having listened to that. And we are listening to each other because this is a conversation. We're learning from each other on what works, what can be leveraged, what is not working, And there's a way women would want to be interacted with when they are when they have to deal with children's health and vaccines. So I want to come back to you, Tabitha, about what you think would be really the messaging or the actions that you expect male relatives or community members should engage in to make you feel supported in ensuring your children are fully immunized, for you to feel that they are equally involved or they are equitably involved. Well, equity and equality are not the same thing, but that they are really involved in a way that is meaningful, that is satisfying, and also that alleviates the challenges that you mentioned earlier on. What are the actions or messages that should come from male relatives and community members? The Prime Minister is here listening as a community leader. The Director of Health Promotion is also taking notes because that is her docket. We are also taking notes, and so is the community health practitioner, that is Mr. Kudu. Go ahead, please unmute and respond to us.
All right. Thank you for the chance once more. As earlier, we came across the challenges we face as mothers when it comes to children, issues to do with vaccination. And sometimes we all understand. I'm sorry for the men on board. I'm not taking it personal, but we know the communities we come from. These communities which believe that the responsibilities of taking care of the kids, anything to do with the kids, is the responsibility of the mother, which is not actually true. As a mother, and as I'm here on behalf of the other mothers, sometimes it pains us. Deep down in us, we are bleeding. It is so painful. If we can also pick it from here, these men on board, I'll appreciate. Sometimes uh, just for a man or a male relative to show concerns concerning children, their well-being, really motivates us as women, as mothers. You are being asked, did you take the child for vaccination? How did it go? How is she or he faring on? And sometimes I'm not a health personnel. I don't know what it comes with, but sometimes, when these children are vaccinated, they cry a lot, they're in pain. Maybe Dr. Emily, you can open my eyes. I don't know. But sometimes you see a mother is struggling alone. This child has been crying for the whole night. She had a sleepless night. The child continues to cry the other day. But the father sometimes is just there and he's busy doing other things. That what breaks us as women. But when we see male relatives or fathers showing concerns, they are in a position to remind you. Sometimes women are busy with house chores, but they are in a position to remind you, oh, Mama so and so, you remember on this day, so and so is supposed to be taken for vaccination. And you feel like there is someone who is also helping you in carrying that responsibility. So I can say in brief, it motivates us when we see male relatives, fathers, showing concern. Words of encouragement, like it's okay, I know things are not easy. Balancing these responsibilities is not easy, but it's okay, it shall be well. That one alone motivates us. And then, issues to do with taking care of these kids, issues to do with immunization, as I said earlier, we have these myths, this fear of side effects based on what people believe. It also needs decision making. So it motivates or it encourages us when we see our partners, when we see other men, uncles, or relatives, male relatives, participating actively. You sit down. Sometimes women, I don't understand, but sometimes women are like, they are always, and it is very easy for them to be convinced. Like if a neighbor comes and convinces you that, these issues to do with this are not good because of this based on beliefs, someone will be easily convinced. But as a partner, as a male relative who is around, you should come in, you support, be active in participating, making decisions. How are we going to balance this? This is the date you are supposed to take so and so. How are we balancing these responsibilities? Okay, maybe tomorrow I can take one day off from my workplace. I will remain with the kids and you take the other one. Or you can even decide to escort. You can escort your partner, your wife. You go to the health center together. At least that one motivates us a lot. And then based on the country we are in, there is this thing I want to put across, public support. Not just only public support, but public support from the most respected male leaders, the most respected male leaders. For instance, here is my priest. We are here with him discussing issues. Even if I was taking these issues to do with vaccination lightly, at least from today I can take it seriously because I've seen most respected, one of the most respected men or leaders in this country is here participating. If it was something else, how come he even took his time? I know he was supposed to be for other duties, but he took this time to come here to encourage, to contribute. So at least this one has given me an insight that this is something never to be joked with. It is something to be serious about. So if we have this kind of support from our main leaders, at least this one gives us an indication that this is something never to be played with. It is something serious and it should be taken with absolute seriousness. So please, I want to request that we as a family, as all of us, this is it is a collective responsibility. And once we do this, it helps like the challenges we had mentioned earlier, these issues of balancing responsibilities. At least if you are together, you can be able to help yourself. You can be able to know that the child is supposed to be taken tomorrow and madam has no money for transport. At least you will struggle in advance to provide her with transport. At least that challenge has been sorted. Issues to do with meats and all this, when you are two, you discuss, convince madam and tell her this is not how it is supposed to be. It is supposed to be this way, this way, this way. Then things will work out. So I see male relatives, our fathers are really needed in this work and we really need their help. Thank you.
Thank you very much, Tabitha. I think I believe every one of us is listening and learning that showing concern that the apathetic or indifferent behavior from men in our communities, as you have put it, bluntly put, is something that really does not encourage women to keep up and stay on schedule the vaccination program. And that really helps us understand how to engage men further when we want to get them involved in increasing vaccine uptake or strengthening our immunization programs, and also giving words of encouragement, having conversations that help to undo the misinformation that women from across communities. And you've also rightly appraised the presence of His Excellency the Prime Minister of the Zande Kingdom by saying that it's important that prominent or public or respected male leaders of our community participate in the conversations. They lead some of these conversations so that it builds confidence. It shows how serious the issue is, and then it undoes the stereotypes or any of the misinformation that might be there around vaccination. And that would be encouraging women to be able to take children for vaccination. I want to feel I will go to I will be able to go to I'll be able to go back to you, Madam Mary. I want you to stay patient because the questions that I have for you are right towards the end. And now I want to ask you, Kudum, what is the last question? Having heard how Tabitha said we should encourage or action. Your Excellency can be muted. It would be, we are hearing background.
Okay, thank you, Emily. I really appreciate. I would like to repeat yourself because I did not hear you well. You have been having
Yes,
issue of network.
sorry about that. But what I'm asking is really what you've seen. You've heard what what Tabitha has told us should be the way men behave or what they should be doing to really encourage women or to make women feel supported so that our children are fine. But now, what specific messages should we reaching out to with should we reaching out with men when we want to encourage them to actively participate in this? And to really get them to understand that this is what the women want, this is what would encourage them walking side by side, so that we cease having it as a women's group, but making an active participation. How, what outreach going out?
Okay, thank you, Emily. It is really a great question, and I want to emphasize on some of the key messages that should be given to men. Engaging men in vaccination efforts require both smart messages and cultural grounded outreach. The key messages that you need to be given to men mostly is that, as I mentioned it before, a strong man really protect the family. And how can a strong man protect the family? Is vaccination is one way to do that one. So that is one of the key messages. Strong men participates in vaccination of children. The another key message is that vaccination keep you healthy and working. It also safeguard you yourself and your children. In this part of point that I want to talk of is when your child is vaccinated, is fully immunized, fully vaccinated, you will not feel worried again what kind of outbreak will come in. For example, during time of measles outbreak in South Sudan here, most of the children were really affected, and few who were not immunized, they were really severely. But those people who were immunized, they were not severely affected. So it is really a part of and working environment. You cannot go to your work while worrying it that my child was not vaccinated. So it is really for a man to at least to know it is a part of his safeguarding for himself and for the child livelihood. So the other message that you need to be given to a man is be a role model. As our prince and mama said before, Mama Mary, that a role model need a really leader in the community to step up in decision making, take action in immunization of children. So be a role model by taking your immunization. It is really very important key. You need to be noticed. The other one is that the facts, they need to know the facts. Make a smart choice of your health and the choice of your child. A smart choice of your health and for that one of your child is through taking your child for immunization. The activities that a man should be involved in is uh, a mobile outreach site where men are working. You bring the vaccine to where men are gathering, especially at construction sites, transportation hub, farms, and corporations. So there, you'll be with them. You'll talk to them face to face. That is the importance of this vaccine. You need your child to be immunized. You need your children to be immunized, and they will know to it. That is one of the key activities that are supposed to be involved in our society. The other one is that the fear education and men champion, as our friends before and the director of National State Ministry of Health have mentioned, we need to use a spear, well-trusted men in the community to be engaged in this conversation and normalize all participation to make sure that all people who are in the community are really participating by these well-trusted men. Another one activity that need to be carried out is that community forums. The community forum, we need to host a session with men that can openly ask questions, share fears, and hear from local health workers and state health workers, especially if the Minister of Health went to a certain states. They need to gather all the men. They will ask their question on the issue of immunization, and they will have acknowledge what is the important immunization from the local health workers, national level and state level. The other one is that is sport and culture. Most of men go to where there is football, where there's sports, local ceremonies. So we need to vaccination drive messages to where the footballs are. Yeah, I do remember when and there was a much resilient visual vaccine. So they said, all men, you need to vaccinate your children. That's a part of it. And people are understanding now. They are now getting that key messages during the football matches. the festivals and other ceremonies, really helping where that activity is really important to them. And many activities that we engage more in is we need to have a transportation reimbursement, especially where a place where people are having low incomes in the far remote areas. For what Mama said before, Mary, you know, reimbursements for transportation. If they bring a child to the facility for immunization, and that mother comes from a very far, and she has a low incomes, then definitely we need to be given something small so that we can take her back. Then she will bring her back for another schedule. Then the last one is that storytelling through social media, radio, where a life story of a man involving himself in immunization of the children should be shown in the radios and drama, plus other WhatsApp. So all these six activities are really important to engage men in participating in uptakes or taking their children for immunization all the part of the country. So these are all what I have. Thank you.
And some of the things that you say, what now I want to now go to Madam Mary. Now that
Hello,
yes, Madam,
hello.
yes, we can hear you.
Yeah, for some few minutes I was disconnected and not connected back, and you are not audible enough.
Yeah, it's okay. And I saw indeed that you had disconnected, but what Kudum should is that we can, if I can try to summarize, is that we can ensure that men engage in forums where there is knowledge exchange with healthcare workers, information about immunization, and this can also be taken to places where they work, like bus stages, it can be construction sites, wherever men gather in groups and work, where it's predominantly the kind of work that gendered towards them. Those are good spaces to find them and speak to them. And some of the messages should be to encourage them to be role models, to be the bearers of the truth, and sharing it with their families. Those are some of the things that. And now I want to come back to Madam Kaku, but had started about the gendered perspective. And we talked about how immunization is really seen as a women's issue in this country. And that, of course, has their,
Excuse
their
Emily. Emily, can you raise your voice a bit, your volume?
oh, okay. My
I'm not.
apologies.
Yeah.
Yes, the question is how do gendered expectations in South Sudan culture affect healthcare behavior and sustainable ways to engage men in, in, in
Okay.
immunization? You had touched on it a bit, but just to elaborate before then I
Yeah.
can go.
Okay. Yeah. Thank you very much for giving me a second opportunity. But first of all, my respect to His Excellency the Zande King, who is on the forum. And by the way, I'm from the Zulu tribe, and we also have a king. And I absolutely agree that, with kingdom, people, the community will always listen to the king. So we are tapping into kings to be able to talk to the communities to come and uptake vaccination. Going to your question, yes, I touched a bit on it. The root causes, I already mentioned earlier that it is something deep rooted in our culture, and and it doesn't mean that it cannot change. And the issue that these perspectives or the gender perspective uh, can actually affect immunization uh, if those cultures are still there, saying that women are the only four people to take care of the children, especially when it comes to immunization. But like most of you talked about, the speakers, I mean, ahead of me, that it is a shared responsibility. Yes, I agree with that. And once we share that responsibility, then, the children will always not be missed during immunization, because there will always be the husband or the family, extended family will always remind the mother to take the child for immunization. That reminder is very important. That support, for the mother, if the mother was sick or she has a small child, she cannot live alone, then somebody from the community, even including the husband, should be able to help her. And most of the, and this can affect, like I said, because, children will not get immunized. Now, with the other challenges that was mentioned by Tabitha and also Kudu, yes, we agree. Yes, those challenges are there, and it can only be resolved when we have forums for men, which is outlined very well. But there is one thing that was not mentioned concerning some of the challenges that we have, uh, especially some men, they would not want to take their child. I mean to say, there are women who usually tell us when we are in the field that when they take their child without permission from the husband would come home and beat her up. That why did you take the child, without my permission? So with the presence of our His Excellency, the Azande King here, I think this one need to be, we need to follow up on that, because there are some men out there. And I've been to Yambio before, and this kind of scenario was brought to me. And wanted to talk to the man to convince him, but he did not even want to see us. So these are like, it's not something that is common, but this sometimes it's there. And so we need to, to address that issue. Um, for the men engagement, there are other countries that have done it successfully. And these are some of the, things that we need to tap into, male engagement, men and boys engagement. For instance, in other countries like Cote d'Ivoire, Ivory Coast, male engagement was very, very, advanced. And they have activities called multi-country vaccine promotion, multi-country vaccine promotion. And they were supporting peers through HIV testing and seeking care through men's, support. So we can tap into this kind of, activities and use man also, especially we tap into their, existing forums, men forum, you know. And also another strategy that was used was that it was working with men and boys to advance gender equality. And this was done through, feminist and human right-based approaches. So there are so many approaches out there that, we can, adapt into our context, the ones that we think is very helpful with us. But having said that, I want to mention that not all men, don't support their families. There are so many of them out there that are supporting their wives to take children to immunization. Even some of them take the children themselves, even a small baby. They carry the baby to immunization. So we want to encourage those men and boys, to continue doing that. Uh, by doing so, then it means that the mother who is overwhelmed with so many children, with the house chores, she will be able to be relieved a bit, to have, somebody supporting her, taking care of the child or taking child for immunization. Meanwhile, she remains home and does some other household activities. So I think all of us have really come up with so good ideas, nice ideas. And I hope we will continue to have such forums going forward. I think this is what Koita, you were asking for, although I did not hear everything. But I hope.
Okay. Yes, thank you very much. You have gone on to give questions and you answered them. And I want to ask the final question to the Prime Minister, and then we can have some few minutes for people who might have questions. Your Excellency, what, besides the community, the traditional leaders that you are yourself, we also have faith-based leaders, and sometimes your messaging or your activities could clash with each other in the community. And where you sit as a traditional leader, what do you think is the role of faith-based leaders and that they could play in ensuring that families are mobilized with child health services? And sometimes there's a clash between traditional culture and the modern or whatever, how we call it, the Christianity, the Islam, and all of that in different traditional religion. How can they be involved, and how can alongside them ensure that organization service? Yes, Your Excellency Tadeo.
Yeah, I don't get the question well. Can you repeat the question?
Oh, the question is how what's the role of best leaders or faith leaders that they play in mobilizing entire family alongside the role you play as the what have you seen them doing mobilize family, especially the men, to ensure that the children get health service they're talking about, the universal health service. And if there are no role, there's no role that you have seen them playing in the community, that is also there and share.
Maybe there is problem on network. I don't get the question well.
Okay.
Yeah.
The role of faith leaders, church leaders, or religious leaders. What role can they play? That you believe, you as a traditional leader, what role do you see them playing, or do you think they can play in the community to ensure that our children get vaccination service?
Okay, thank you very much for this question. I think I earlier mentioned that we and we are the custodian of culture. Also, we look after people. We care about the health of our community. So for sure, we have a big responsibility to ensure that our society are complying with issues relating to their health. Before I can say what is our role, we need also to have responsibility. We are looking into how can we have a partnership with those who are giving the vaccination. Simple because it will not be helpful when you just come and targeting the community at grassroots without the involvement of the traditional leaders. So this is how we are looking into how can the traditional leaders be a partnership with those agencies, beginning from the strategy, laying the strategy for that. Our involvement should be there in the strategy making process, and also in planning how to do it. Because today, when you come and go to the village, you want to make a vaccination and find out that you can end in the nearby clinic where there is access of network transportation, and then call somebody like 3 miles, 4 miles to come and make vaccination. This is very impossible. because people are walking by foot. There is insecurity on the way. So sometimes a woman cannot walk all distance to where you are for vaccination. And in your side, you can see that those community are not compliant, and not knowing that it is you, how you plan it was not sufficient. It was not affordable for people to turn up. So when there is a prior partnership with the community, we can be able to identify the location of people, where to conduct, which time, and all this also will help time management and other issues. And also sometimes we are very keen, or we are very adhered to our culture. So if a man in the house, he don't have any information that there is a vaccination taking place today, and just of a sudden coming from work or from farm and found that his wife is not there. So this is also an issue. This is coming because there is no pre-information. Pre-information through partnership, we can be able to address our people that at this particular time, date, there is vaccination coming, so that they don't misunderstand or also put their wives in problem. So those are the issues concerning the administration of this thing, and we wish that that is going to be improved, and then we become now partners in carrying this. Our role is great, that we mobilize people, we explain to people what is the importance of the matter, and also we talk it in culture background, identify the risk, and also explain where the risk, and make it for people simple and to accept.
Okay, thank you very much. That is so much about the role of traditional leaders, but I also see echoing the need partnership between traditional and religious leaders, and also everybody else who's working to ensure that work alongside each other in terms of getting out there. Thank you very much. That brings us to the end of the question and answer session for the speakers. And if there's somebody in the few people who are here, they are the only ones who can hear you directly, and those who are following on Facebook, I don't know who are able to ask for questions by speaking. Those of you who are on the call, if you want to make a comment that our speakers should hear, or you want to ask a question, please raise your hand, or if you don't see anybody has raised their hand, just unmute. Welcome. I don't see anybody who has asked a question. And now that there is nobody who has asked a question in the chat, as those who are preparing maybe to make a comment about what to say, I want to ask Tabitha just another follow-up question. Tabitha, in your opinion, how do we encourage families to address this women and women? We've already talked about many other things, but it's working in other countries, and all that the community does, and what has worked in some places from the community. But within the family unit, how do we encourage this dialogue to take place so that then you don't have a man beating his wife child who has taken vaccination?
Wow. Thank you once more. I don't know whether it is internet connection. I was not in a position to get you properly, but let me assume you were asking of how to create, is it more dialogue in the families or communities?
Yes, about how
Okay.
to have dialogue happening in the family unit so that challenges that you face with.
All right. It's actually, it depends. Sometimes what matters is the way things are being framed, how they are designed, and how they attract people. And I can share an experience. There is this one day I went to visit Lologo PHCC. I went there for vaccination when I was pregnant, and to my surprise, and something I've never seen before, in fact, I've been passing near these health centers. I've been escorting some friends when I was too young. But what I saw was that what people could do when mothers bring their kids and when these pregnant mothers also come, what they do before they are given the medicines or before they are vaccinated, when they are in the line, there is what they do. They always give them breakfast. There is this big cup of milk, hot milk, a half liter. There is mandazi in plenty. And I was telling myself, this is actually good. Sometimes even when we are feeling tired, you feel like today I don't want to go, but to someone like me, when I remember that one cup of milk, it motivates me. It even gives me the energy to go. So one of the ways is we should have like family health days. Maybe we can have it on radio station discussions over the radios. We can have a program on with the like these TVs nationwide. We can set aside some days where everyone, family members, including the fathers, the mothers, the relatives, can be engaged on how important it is to have this shared knowledge on vaccination. How can we take care of our children health-wise? And what is the responsibility of so and so? Having done that, that one will even, at least that very day, the family can decide after, when the program is done, the family can decide to sit down to discuss issues on children's health. See how it motivates them. Sometimes it is hard to just begin from nowhere. People are busy with other duties. But when we have such programs as a community, that one it will motivate the family. To an extent, they will create or they will have a fixed date. Let's say they can be like on the 15th of every month, we are going to be sitting down as a family and we see how have our children been faring on with their health. What are some of the improvements? We can at least can remind these are the families, the members. But sometimes when there are no programs, people just run from January to January. Families do not even care. They don't even check up on their kids to see the child is losing weight and no one cares. But when we have these constant programs, at least this one reminds parents and it tells them this is never something to be joked with. If the nation can invest time, resources to do this, why not us, the family? So I'm seeing that is one of the ways we at least have family health days, forums, where families can be educated on how to take care of the kids, what are the importance, and how good it is for them to share this responsibility. And then there is this thing, usually where I find these people who are wearing community members, they only target the women. When there is anything to do with children, I'm only seeing in that meeting they are only women. I'm wondering what is happening. And this is what we saw earlier. We have that belief that anything to do with the health of the child is a responsibility of the mother, which is absolutely wrong. So I'm seeing we are supposed to train these community health workers to at least even involve males in outreach, in health outreach. Not only should they target women, should they target mothers. I've seen this one severally, where women are the ones to be aware on children's health issues. We should also involve others. At least once we do that, people will understand, and they will understand this is a shared responsibility. We are supposed to do, all of us. And this one will trigger family discussions on health issues concerning these.
Now you opened our minds, you hold us up, held us accountable. Many awareness campaigns tend to target women, which emphasizes the messaging as that of only immunization as and of child's health as only women, and that we should really be deliberately targeting them. Now, I want to go to each one of you. Only have 9 minutes left. You each use 1 minute and say your parting shots. The most important thing that you think everybody else who will be listening in later, watching this later, those who are right here with us right now, should go with from you. If they can forget anything else, please do share that one thing as your parting. And I'll start with you, Your Excellency. Right. Please go ahead.
Yeah, thank you very much for this chance. And I would like first and last to say thank you very much for taking this program seriously, because our community are suffering. And in order to have health community, we have to take care of our children. So I don't have much to say rather than number one is we need partnership between the, those who are providing vaccine and the communities. Why so important? So that we can have full details about this and communicate it to in our culture and in our language, so that to take doubt far away and then let people understood it and make it easy for people to comply. Number two is also for follow-up. If there is any case, we can be able to raise the impact of the vaccination on community. So what is happening for us is you just go and take vaccination and go home, nothing else. There is other issues. The complication may be there with the children. You don't know where to go and so forth. So people have to report. And from there now, we have a progress in this campaign. The last is we are just making assurance to, as a traditional leaders, that we comply with this program of vaccination, and provide that we need additional assurance. You already hint that we have expertise at national level, but we would like to see even the traditional leaders are member of that Bureau of Assurance. Because there is a lot of things there. So we need to have member of traditional leaders in this board health assurance of South Sudan, so that we make sure that these things are normal for our people, because this is the challenge we are facing. People ask us a lot, and we don't have even terminology of health terminology we cannot understand because simply we are not aware of it. Thank you very much for this chance. And I will invite the South Sudan women in medicine to visit the Azande Kingdom. Thank you very much.
Thank you very much for those parting remarks and for the presentation. We will honor it and having it. Frankly, says that specifically with the kingdom, in that manner that you have always done will be and answer to that. Thank you very much. Yes, Madam Mary, you next. Parting shot. Anything else that you think we can forget everything else that we remember at the end of this webinar?
Okay. Yeah. Thank you very much, South Sudan Women in Medicine, for hosting this very, very important forum. I think one thing that I want us to take home with us is that we want the community out there, especially husbands, the community leaders, the religious leaders who are out there, because the women are overburdened, overwhelmed with a lot of work. So we want them to support this woman who is there in their neighborhood, so that she is able to take her child for immunization. At least reminder, let them remind the woman. And if the woman is not able to take the child herself, we have extended family. Even if there is a male, from the extended family, he should also be able to support this woman by reminding her to take the child for vaccination. Husbands should be very, they should be able to really support the women. Don't leave the women, the work on the burden on the woman alone. Should be a shared responsibility of both man and woman for the welfare of the child. If both men and women are involved in immunization, I assure you there will be no child left behind. All children will be immunized, because it's not that the woman doesn't want to take the child, but she has a lot of other responsibilities that is making her not to take the child.
Thank you very much. And Mr. Kugum, yes, you're there. Yes, please go ahead. Your parting shot. You can mute and say your last closing remarks in just a few seconds.
To me, to me,
Yes, yes,
thank
Kudum. Please
you, CM. I really appreciate for hosting this sign of uh,
Kudum, I think you
of
can
the intervention
guys.
and
Guys,
advocacy.
Don't hold on. Give your internet time to stabilize. Can't hear you. Tabitha, you can go. You can go ahead and as your parting shots, remarks, and what we shouldn't forget that the message is not only for the end of the.
All right. Thank you once more. I'm honored to be here. I've not really taken it for granted. Thank you for the chance. And the colleagues, thank you for your time. We will meet again by God's grace. Forgetting everything, the only thing I can tell us, and this one I am not a feminist in fact. So maybe someone you can say she's a feminist, but for my case, I know I'm not a feminist. But I can tell my message goes to my prince and the rest of the brothers. Let's help our women. Let's help our mothers. This is a shared responsibility. It should never be left to one person. And as we said earlier, just showing this concern alone motivates us. You know, when we take it to be one-sided responsibility, sometimes as the mothers, we are not open sometimes when the child is not being well, because you know who will even understand you. Why do you need to waste your time? Because you will never be understood. But when we take it upon ourselves as a shared responsibility, at least we can be able to share when the child is not fine. You have someone to run to for comfort, you have someone to run to share ideas with, and then plan together, think, what should you people do? Do so, please. It is a shared responsibility. Help us as mothers to raise these kids in a healthy manner. And I can also tell Dr. Emily plus the rest of the health personnel, you should also help us to aware men. When we only target women, then automatically uh, it becomes one-sided. But please help us to reach out to fathers. And that's why we came across this one point. Mama Mary said that someone refused the child to be taken for vaccination. Because some of these men even don't understand what is vaccination and how important it is. But when they are reached and they are given knowledge, at least they will be in a position even to be the one to remind us. So I'm not blaming them, but sometimes it is lack of awareness, it is lack of information. They don't understand the importance of this issue we are discussing. So please help us to reach out to them, educate them on the importance of these vaccines for our children, so that they can also join hands with us and help us. Otherwise, thank you.
Thank you very much, Tabitha, for the powerful message that you given to us and also sent to us. And now I would want to invite first time. I know we started. Kudu, if you're still there, you can now your last words or what you want.
Sorry, Emily, I cannot hear you well. Your voice are least diminishing. Hello, hello, Emily. Yes, I'm not hearing you well. Your voice is diminishing.
Can you hear me now?
Yeah, you are loud and clear now.
Okay, what I'm saying is that you can tell us your parting shots or your closing remarks. Something that we should get out of everything that you shared during today's meeting.
Okay, thank you. It is a really great pleasure to join this conversation in SIM in this platform. Uh, what I want to tell to everybody who is here, it is our key responsibility for child health. If we don't take care of our child health, then we will have no generation. So, especially as a man, it is your key responsibility to have generation. And have a generation, you need to take a lead of giving a child a vaccine by taking him or her for vaccine. So all in all, as we health workers, we encourage everybody to participate in any health programs, especially men, because these are role models, these are the key head of the family. Once they understand it, it will be really very good for the health of the family to be a right position. So here we need to take lead in all everything concerning of health of a child. It is our role and thank you.
All right, thank you very much. Thank you, yeah, because of our third webinar. And we are 5 minutes past time, and we appreciate you sparing the time to be with us. We know that for one reason or another, people are not able to be present here, the numbers that we want, but they do watch what we live stream on Facebook and And so there are many people who will watch this. I want to read out a message in the chat that is very important because you might have missed it. There's somebody who says his name is Kip Manyot Deng. He's the holder of a global health, a master's degree in global health studies, and he's also a medical doctor. Graduated from Universal, and says that he has really learned a lot from all of you in this conversation, and he had looked forward to sharing more, but time has not allowed, and he's impressed by the conversation. He hopes that we can consider extending awareness roles on social roles in immunization to people and integrating immunization with nutrition to maximize or to minimize the deficiencies related to lack of immunization. And then also increase the role of civil society awareness programs and requesting the ministry to support the extension of programs to rural areas. And we wishes us. Thank you. If that is well noted, I want now to make an announcement that we will be having the last webinar on Friday this week at same time, 2 p.m., 4 p.m. Central African time, what they commonly say is Marseille time. That is when we'll have the last webinar. And it will be about, the topic is about empowering the front lines and strengthening the healthcare workforce for a vaccination program. We will see how healthcare workers can be made champions and empowered for South Sudan's immunization program. So that's discussing on Friday, and we hope all of you can find time to join us. And having said that, share that announcement, the other thing that we would like everybody to know is that we'll be compiling a report of all this webinar series, and we'll be sharing with everybody for our webinars, whether they manage to attend or not, we'll be able to share with them because we want to be gathering. So please do attend. And with that, I would now like to request that we do a photo session, a virtual photo session. I would like to request all of you to try and switch on your cameras, if possible. I know the Prime Minister's camera is on. Let me switch mine on. I had switched it off because I felt it was affecting the bandwidth of the rest of you. But now, yes, Mary, I see. Tabitha is on. If Tabitha, could you please switch on your camera? I'm going to count 1, 2, 3. And I would want you to smile. Okello, you're on. I would like you to turn your camera. I see Sarah has turned her camera there. Okello and Tabitha, we are waiting for you. And then I'll take you. Okay. Okello is not able to sit down. Tabitha has gone. Tabitha is there. Tap a little bit and smile. Sarah, you're in the dark. Okay, that's enough. We have enough. That's enough. You might see that somewhere either on our website or on our social media. Thank you very much. It has been a pleasure and an honor to have all of you join our third webinar. We look forward to continuing engaging with you on this conversation on vaccination, and not just vaccination.
Bye.
And we'll honor the invitation, Your Excellency.
Thank you.
Bye.
Bye.